Welcome to today's live webinar, Don't Be Shell-Shocked, Reptilian CPR 101, sponsored by VetAhead. We're so glad that you're here with us today. We also want to extend a warm welcome to our YouTube audience. I'm Sam, and I will be your host and moderator today. I'd like to cover a few housekeeping items with you before we begin. This session is being recorded and will be available later this week as an on-demand course on Vetfolio for a limited time. If you registered on Vetfolio and are attending the session live, no further action will be needed to obtain your CE credit. If you registered on YouTube, be sure to fill out the jot form provided in the chat. You will see your CE certificate in your Vetfolio learner profile within 24 hours. And with that, I'd like to go ahead and introduce our speaker. I'm so excited to have with us once again, Lila Proenza. Dr. Proenza is the founder and CEO, Creative and Visionary Opinionated, of VetAhead. She is moving the needle in the veterinary space alongside VetAhead's teams. Their why is no species left behind. What they do is empower veterinary professionals through knowledge. And their how is to make zoological medicine accessible by providing everything you need to see zoo med patients at vetahead.vet. Now let's toss it over to our guest, Lila. Thank you so much for joining us.
Hello, everyone. Good morning or afternoon, evening or night, anywhere you are in the world. Thank you so much for the lovely introduction. Thank you, Vetfolio, for this amazing partnership that we have throughout the years. Always a pleasure to come here. I can see so many people saying hi. It is amazing. I want some of you, I putting, it says Canada loves you. Hello from UC Davis. This is amazing. Okay, some of you are putting where you're from, but I love to know where you are from, where you are in the world. I am in San Diego, California, in the United States, but I am born and raised in Brazil. So if I have Brazilians in the house, hello, oi todo mundo, welcome. I know I saw already João and José Pedro from Portugal. So tell me here on the Q&A or on the chat, sorry, where you are. Texas, Houston, India, Chicago. Oh, Chicago, you are under so much snow, right? Ocala, Florida, India. Oh, Massachusetts. I can't say that, really. Amanda says San Diego too. Woohoo! Puerto Rico, Benito. I really want to go see his concert. New York, Utah, UK, Ohio, Alberta, Canada. So many people from Canada. Malaysia, Indiana. Heather is from Tennessee, Ontario, Canada. Russia. Oh my God. You guys are from Romania, Switzerland. You guys are from everywhere. Connecticut, Thailand, Virginia, Taiwan again. Olá de Portugal. So amazing. South Carolina, Kansas, Portland. I'm going to be in Portland for AHA in September. Actually, I'm going to have a stand-up comedy show in the AHA conference. Can you imagine that? That's going to be amazing. Anyway, lovely to have all of you here. Today, we're going to be talking about CPR in reptiles. I get so many questions about that. And I am going to be presenting to you. Let's move over because I know this is what you want to do. And that's why we're here, right? To learn some CPR. So I know that in reptiles, it can get a little bit challenging to figure out how do we do things, at what rate do we do things, and how do we place leads, ECG leads on a snake? That question I get so much. How do we do cardiac massage in a chelonia, a turtle or a tortoise? We're going to be learning all of this here today. You are welcome to answer your questions during the presentation because, as you know, I really love to Jerusalem, Dubai, Minnesota. Sorry, I just got Florida. I just got a little sidetracked because I love to answer your questions. I think it really enriches our presentation if they come during the presentation. And of course, if I miss something, Vetfolio is here to let me know that we have questions. So I would ask you to ask as you go. Let's start with our webinar. So first of all, I wanted to quickly say we have a lot of supporting material because here we in 30 minutes we are going to be covering the CPR itself, right, based on the recover guidelines. But we have so much content at our VetaHead subscription. At the end of this presentation today, after our 30 minutes together, I'm going to be showing you a little bit of VetaHead. So I would love for you to stick around. We can chat a little bit more. I can answer some more questions, and then I can show you a little bit of VetaHead because literally it's everything you need to see Zoom Ed or exotic animals in a practice. We have a VetaHead. Take a screenshot of this screen because I have 2 QR codes there for you. One is for you to join a subscription and get more information. And the second one is for you to look around the subscription. It's a free sneak peek, and you can kind of look around before you decide to subscribe. So those are there for you. And I also want to touch on something that it's a little bit of a myth, let's say, which is CPR success rate. We know that CPR success rate, it's not huge even for dogs and cats, right? We know it's low even for dogs and cats. But that doesn't mean that we shouldn't attempt CPR. And we have 2 main studies on Zoom Ed. Every time I say Zoom Ed, guys, it means exotics, okay? We have 2 main studies on exotic animals, not necessarily just for reptiles. One is a retrospective study. It's a little bit outdated already. It's like 10 years old. They have over almost 150 exotic animals, so reptiles are in the mix, and they saw that the return to a spontaneous circulation or the success of the CPR so they did at CPR, at discharge. They noticed that the ROSC, return of spontaneous circulation, was 9.3%. The survival after the CPR, so they brought them back, but then let's see if they're going to survive. That dropped to 2.3%. And then the survival at discharge, right? So they came back on the CPR, they survived after CPR, and now they were able to be discharged. That dropped to 1.2%. But look, the success of the CPR, so bringing them back, was 10%, almost 10%. So that's definitely worth trying. It could be that one animal, right? That one pet that's going to make the whole difference in that person's life. I know if it was my pet and my pet was that 1%, I would definitely want the CPR. And they also have a retrospective study in birds that they have higher numbers, so 7% of the patients. But it's important to say here that some of these patients were already anesthetized, so they were already intubated. So that made it expedited things, right? We are going to be basing our lecture today and all our guidelines on the RECOVER CPR guidelines. As you might already know, we have a new RECOVER guidelines. They were published in 2024. So we're going to base all our CPR guidelines for reptiles on this RECOVER CPR guidelines. Now, these RECOVER CPR guidelines, they don't cover Zoom Ed, they don't cover exotics, right? But we are going to be extrapolating all the data from them, okay? And using their guidelines and teaching you the differences. These RECOVER guidelines, by the way, they are open access, and you guys can definitely read the entire paper. If you just put RECOVER guidelines, RECOVER CPR guidelines 2024 on Google, you will find the paper and you can read it in its entirety. But I have for you here what's really special. I see a lot of people asking here about if there will be a recording. And yes, Sam just from Vetfolio just answered, yes, there will be an on-demand video on Vetfolio. Okay, so we are going to start with our basic life support, and then we're going to go to our advanced life support. Very important is if we have more people doing CPR, we don't need to follow this, right? We need to go we can go on basic life support and advanced life support at the same time if we have enough people to do both. But if we don't, that's when we follow these steps. Shelby saying, shout out to the RECOVER app, my favorite code too. There you go, guys. Another tool. Shelby, thank you for sharing. You know what, Shelby? What you should be really giving a shout out to the VetaHead app. Sorry, I had to throw it out there. Okay, so the basic life support, first step, and this sounds so obvious, but it's not, is recognizing that the patient is unresponsive. But the one thing I want to say here, guys, is if you have your Zumed patient, your Zodiac patient hospitalized in a far corner of the hospital because you were told that they need to be isolated because they are prey animals, etc. First of all, not all Zumed pets are prey animals. A snake's not a prey animal. A ferret's not a prey animal, right? But if you have them in the far corner of the hospital, you're never going to see them code, and you're not going to be able to implement all this knowledge we're going to learn today. So they need to be where the other patients are, guys. Keeping them separate is a myth, because if you have a special place for exotic animals, I bet you are hospitalizing a snake in the same place you hospitalize a rat. Or if you have a special room to see them, you're also seeing a ferret in the same room you see a bird, and they are prey and they are prey animals and predators. So it makes no sense. Have them together with the dogs and cats is fine, right? Just common sense. If it's a barking dog, nobody wants to be close to a barking dog, right? Okay, so first of all, we need to be seeing them to see when they are unresponsive. That's the first step. And then we're gonna do the ABC, which is airway, breathing, and cardiovascular. So for airway, we need to first of all identify that they have coded, right? So they don't have a heartbeat, they don't have a respiratory rate. And we're going to talk about heartbeat in reptiles, how we're going to actually assess that. But the first thing we need to do is open their mouth and check the airway. And for us, actually, it's so easy to check their airway, way easier than it is for a dog, for a cat, right? So their glottis and their trachea, it is so visible because they are rostral. So here on the picture, we have two examples. One is a tortoise on the right side of your corner. So you can see that black hole right there is our trachea. And then on the left, we have a snake. So open the mouth. Is that something blocking the airway? Is there discharge that you can clean? Is that pus? So is the airway patent? That's first step. Then two, is the patient breathing? Can you observe the chest excursions? And I have there for you to show the chest excursions on a turtle. It's being ventilated, but it's just to illustrate how they will move, right? Because the chest excursion is going to be a little bit more difficult in a chelonian because they have a shell. In a lizard snake, you can actually see, we're saying chest here, but we all know they don't have a diaphragm. So it's called the coelom. When I say chest, it's just to refer that the first part of the body, right? Where the lung is. Now, here's a little tricky for us because they can hold their breath, right? And sometimes we're not going to see chest excursions because they're going to be holding their breath. So now, when they are holding their breath does not mean that they coded. And that's why I'm saying it gets a little bit tricky. And that's why we also need to check the heartbeat. But then you go like, there's another catch here on the cardiovascular, because we can't auscultate the patient for a heartbeat, right? We can't put our stethoscope on them because they have scales. And they scales, all you're gonna hear when you put a stethoscope is like you're not, it's like their stethoscope going up and down the scales. That's all you're gonna hear. Now, there are some techniques that you can put some gel or some cotton ball with or gauze that's moist and put a stethoscope on top of it. Still is going to be so faint. I would advise against it. In these cases, we're going to be using a Doppler, right? So this tool that you see here is the Doppler. And then you're going to be able to hear the pulse or the heartbeat. Now, very important to notice is that the heartbeat in a reptile can be present even when the patient is scolded. Okay, so that means patient is dead and we still have a heartbeat. It's not a full heartbeat. That's why we will also be using ultrasound when available to see if it's a real heartbeat. One tip I'm going to give to you is, in snakes, I always like to have a tape or a marker where the heart is. So it's easy for me to just go there and check the heart rate. Usually for the majority of snakes, if we divide the snakes in 3, thirds at the end of the first third, that's where the heart's going to be. It's going to vary a little bit from snake species to snake species, but that's a good rule of thumb. And then I mark it. I put a permanent marker there, or I put a tape around so I know that's where I need to be checking, right? Also, I know where I need to do cardiac massage. So that's what we're going to be doing. We're going to be auscultating, in this case, using the Doppler. For chelonians, we can put on the area of the neck where we're going to have the carotid artery right there. And then for lizards, even easier, we put at the chest area, so between the thoracic limbs on the ventral aspect where the heart usually lays, sometimes a little bit more caudal than that. I see we have some Q&A. Can you show again the QR code? Absolutely. At the end, Joyce, I'm going to show it again, okay? And you're going to be able to take a picture. Thank you, Joyce, for asking. Okay. So moving on, so we did our ABCs, and now we noticed that we have cardiopulmonary arrest. Okay, so we all know we're gonna have the ECG, we're gonna learn how to place the ECG, but we all know that line, right? That line that we do not want to see, that flat line, the cardiopulmonary arrest. So what we're gonna do, and I also say, if in question, say, because I just told you, they can hold their breath and then their heart can be beating even if they're dead. Look at all the signs, guys. Is there palpebral? Is that corneal reflex, right? Is that jaw tone? Is the patient moving? All of those things. But if in doubt, start CPR, okay? Etia says, can you explain again how can they still have a heartbeat if they're dead? Because reptiles, everything happens really slow. So there will be a delay between the time they actually die, they have a cardiopulmonary arrest, and when the heart actually stops beating. So obviously, it's not going to be a complete heartbeat. That's why sometimes we need to use the ultrasound to see. That's just how their physiology is. Okay, so we identified cardiopulmonary arrest. What is the first thing we're gonna do? That's why I'm saying Etia, also, if you are in doubt, start CPR, okay? The ET tube we're gonna be talking about, wait a second, we didn't get to ventilation yet, okay? Okay, so cardiopulmonary arrest, we identified it. The first thing we're going to do is start compressions. And here I'm saying chest compressions, but remember, it's not a true chest, right? But it's the heart compressions. We're going to start compressions right away. Okay. The goal of the compressions is to restore that pulmonary and arterial blood flow as quickly as possible. And here, guys, a measurement of a good compression is your entitled CO2. I'm going to talk a little bit more about it, but we want entitled CO2s for dogs and cats. They're above 18 millimeters of mercury. We're going to talk about cats here for reptiles. Okay. So we're going to start our compression. Oops, sorry. So the compression rate, what is the rate? For dogs and cats and the RECOVER guidelines, we talk about 100 to 120 compressions per minute. Now, this is way too much for reptiles, right? Because reptiles, they have lower rates. What is the normal rate for a reptile? Well, we actually don't know that. The only species, to my knowledge, we know is an iguana, because we do have a study in iguanas, but then here's another catch. You will have to have the iguana at the exact same temperature that they had that iguana in this study, the iguanas in this study. So here two advice for you, recommendations for you. This is what I do, okay? One, you probably already did an exam on this patient when this patient was not coding, right? And in the room temperature where your hospital or clinic is. So what was the heart rate? We're gonna try to mimic that. So we was at 40, so we're gonna try to do 40 compressions per minute, okay? So, and if say, no, this patient arrived already coded, well, you probably seen a tortoise before, you probably seen a snake before, and you know what the heart rate should be for that species. Now, I would say a good rule of thumb, 40 to 60 massages or beats per minute that we're trying to accomplish here, okay? Now, the depth of compression. Before, this is new information, okay? Before, we would say on the previous recover guidelines was half of the depth of the chest. Now that has changed to 25% of the depth of the chest, or 1/4, okay? And usually we'll have these patients in lateral recumbency. For our patients that are small, but again, like chelonas is going to be a little bit different, and snakes sometimes it's easier to have them on dorsal recumbency, and we're going to use the finger technique for the majority of our small patients, or the lateral hand technique, where you use one hand to massage them because they're very small, right? Now, chelonians, we can't really properly do chest compressions on them because they have a shell and they have a plastron. So you can't go there and massage the heart. So one thing that we can do to try and increase perfusion is move the limbs, all the limbs, the thoracic limbs and pelvic limbs, in and out at the same time. Okay, so you need two people, one to hold the thoracic limbs, one to hold the pelvic limbs, and you're gonna put them inside of the shell and extend them again at the same time. That's not a proper cardiac massage, but that's definitely help. Okay, now here we have a turtle actually that we were doing CPR, and we were able to bring him back. And we are going to follow the same rule. We're going to do a CPR cycle of 2 minutes. So the recover guidelines, we always have 2 minutes of rotations. And after these 2 minutes, so we start compressions. After these 2 minutes, we are going to check if the heartbeat is back, if we brought the patient back. And we also rotate the person that is doing the chest compressions, okay? And then, of course, if the patient at that point, if you had more people and at that point the patient was ventilated, we will be ventilating that patient throughout this process. But if not, at the first cycle of 2 minutes, that's when you're going to try to ventilate them as well, which I'm going to explain to you, okay? So the next step is ventilation. So we started with cardiac massage, ventilation. For all patients is actually the reptiles is going to be very easy to intubate them. So we're going to be using tubes that are, they might or may not be cuffed. For all chelonians, turtles and tortoises, we're going to use uncuffed tubes. Why? Because their trachea has complete tracheal rings, okay? So we can't inflate a cuff. That's going to cause necrosis on those rings. Now, we can also use a special tube called the Cole tube, C-O-L-E, Cole tubes. These Cole tubes, they are narrow at the tip. So you introduce the entire tip of the tube inside of the trachea. So this larger part is going to sit at the glottis and it's going to provide some seal, because that's the catch I was telling you about the entitled CO2. Because we're going to use majority uncuffed tubes, there will be air leaking around the tube, and we are not going to be able necessarily to get the 80 millimeters of mercury of entitled CO2. Okay, so it's going to be lower, and that should not discourage your CPR. Now, we did basic life support. Now we're going to do advanced life support. And that's when we're going to be connecting our monitoring devices. Okay. So now we did cardiac massage. We intubated the patient. We are ventilating the patient. And now we're going to go to advanced life support. The first step is monitoring. The only 2 pieces of equipment that we need during CPR is the ECG and the entitled CO2. Nothing else. Okay. And obviously for the ECG, we're going to place, if you're doing 3 leads or 2 leads, we're going to be placing the leads above the heart and below the heart. In a leads in a chelonia, arms and legs. In a snake, the tape marks the heart. And then we're going to do 2 leads above the heart or cranial to the heart, and the other 1 lead or 2 leads below the heart or ventral to the heart. Okay. Okay, so what our parameters is to know if our massage is working, our cardiac massage, because we're not going to stop that, right? We're going through these steps, but we're not stopping cardiac massage, but we are changing the person that is doing the massages every 2 minutes and looking for a heartbeat every 2 minutes, right? Or an ECG that shows the heartbeat. Our goal here for the recover guidelines for dogs and cats is to try to keep this entitled CO2 above 18, but that's not going to be possible necessarily in reptiles because of we just talked about. Okay. Also, when the patient regains a heartbeat, you're going to see a spike on your entitled CO2. That is another reason why it's important to have the entitled CO2 there. Once we have, again, the entitled CO2 and response, the spontaneous response of circulation, return of spontaneous circulation, the ECG is when we're going to be assessing the ECG to see if we give drugs or not. Remember, so far we have not given drugs, right? Because that's not the first step. Also, a big disclaimer, I'm not going to be talking about shock treatment, because we don't have guidelines for reptiles. So therefore, I don't use it. And I don't have a recommendation to use it. So even though we're going to have some information here for dogs and cats, that's not something we're going to be doing for reptiles necessarily. So to this point, we had not given drugs, right? The drug should only be given once we assess the ECG. Then we haven't already given drugs, and the next step is going to be to vascular access, either IO, interosseous, or intravenous, right? And of course, guys, the only drug we should have given right at the beginning is any reversers in case your patient was sedated or anesthetized. On the VetaHead subscription, we have multiple illustrations for you of places to place an IV catheter, an IO catheter. These are some examples. I'm placing here on a bearded dragon. I'm placing IO catheter on the tibial tarsus, or the tibia, sorry. But we can also, and always, obviously, preferably check with x-rays if it's well placed, but during CPR, not necessarily can do that. We can use transillumination to look for the veins. Right there in that gecko, we are looking at the jugular. On snakes, I often go for the heart because we don't have a good way to place an IV catheter on a snake that is coated. So he is demonstrating collecting blood from the heart. But as I said, I also give the rescue drugs there, okay? And the chelonia, looking here, jugular vein as well. And also we can place IO catheters, interosseous catheters as well. And this is demonstrating jugular. Sometimes we need to do a little bit of a cut down to see it properly and secure it if possible. Now, I keep showing the IO catheter that I just placed on that turtle that was undergoing CPR, also on the tibia, and showing there the IV catheter, the IO catheter on the X-ray, sorry. So what's next? At this point, we've been doing 2 minutes intervals. We've been monitoring with ECG and tidal CO2. We have been ventilating the patient. That's when we are going to give the drugs or check for a ECG to do the shockable rhythm. And that's going to be in dogs and cats. Again, I am not going to be going on that for our reptiles because we don't have the guidelines. Okay. So if you are checking, so you're checking the 2 minutes, you're checking for your ECG. If there is electroactivity, are there pulses present, which might be tricky again in reptiles? That's what I'm saying for you. So basically, we're going to check, do we have a heart rate or not? If we don't have one, that's when we're going to give drugs such as epinephrine or atropine. And then that's when that's where we're gonna go to the drugs. And we're almost at the end here giving our drugs. So epinephrine is gonna be our drugs, and that's being the only drug to be shown to have an increased chance of ROSC in dogs and cats. but we're going to be using here the epinephrine at the lower dose. And if we don't have intravenous or intravascular access, we can also give intratracheally. We just need to double the dose, okay? And then we're going to give the low dose epinephrine. This is also new on the new RECOVER guidelines. And then atropine is going to be used only if absolutely necessary, especially in cases where the patient coded for things that stimulate the vagal tone. So thoracic masses, gastrointestinal diseases that cause enlargement, ocular diseases. That's when we give atropine. And if given, is given just once early on the CPR, and also the lower dose. Okay. Doxapram has not been shown to increase the ROSC in dogs and cats, but there is one study in ball pythons that were sedated with dexmedetomidine that showed that they ventilate better. So I often will give doxapram, but we don't have any proof that that works for CPR. And last, post cardiac arrest, if you were able to bring your patient back, that's when we're going to do blood work, put them on fluids and all of that, because we want our patients to actually do well and be discharged after CPR. Sometimes euthanasia is going to need to be done during the CPR, unfortunately, right? And we need to be prepared to have that discussion with the patient, with the owner as well. And here is we come to the end of our presentation. Those are the 2 care codes for vet ahead. And I am happy to stay here and answer a little bit more of the questions that you have here. And I would also love to show vet ahead to you. But before I do that, before I answer more questions, and before I show you vet ahead, I'm going to let Sam see if we have any housekeeping things, but I will go through here and answer all the questions you guys have here on the chat. I see we have a lot of questions. Sam?
Thank you, Lila. Make sure you look at the Q&A too. A lot of the questions got moved into there, so you'll see there's maybe 7 or 8 questions in there.
Okay.
Okay, so in case anybody needs to hop, let me just say as a reminder, if you're registered on Vetfolio and attending the session live, no further action is needed to obtain your CE credit. If you registered on YouTube, be sure to fill out the JOT form provided in the chat, and you will see your CE certificate in your Vetfolio learner profile within 24 hours. And for some of you that were asking about seeing it again, the session will be available on demand through Vetfolio in the coming days. Okay, with that, I will let you take it away, Lila, to do the Q&A.
Yes, absolutely. Thank you, guys. Okay, I will try to get to all your questions. First, I'm seeing here you asking about ventilation. Great question. So, are there resources of ventilating in reptiles? First thing I want to say, and this is an excellent question, please do provide oxygen, okay? The idea of not providing oxygen so it stimulates their respiration, it's old school, has been debunked a bunch of times with peer review papers. So please do provide 100% oxygen in your ventilation, just like you do for dogs and cats. Now, what rate should we be ventilating them? Again, we don't have normals for them, right? So what I try to do at least 4 respirations per minute. Okay, that's what I try to do for the majority of reptiles. So that will be 1 every 15 seconds. Okay. Let's see here. This might be controversial, but what is your go-to for ventilation? Oh, that Samantha Shepard just asked that. Do you use 100% ventilation? That's actually not controversial. It's just a myth that has been debunked a lot of times. It has to be 100% oxygen. They do increase the pressure of oxygen, arterial pressure of oxygen when given oxygen. Okay. When we recover reptiles after surgery, we do ambubex. We should be using oxygen. Okay. They will not. So the worry here is that if we give 100% oxygen, it's not going to stimulate respiration. That is not true. Okay. They will return to ventilation, and they will increase the pressure of oxygen. Okay. That also, let me see here. Atropine is recommended once as soon as possible in all non-shockable rests, asystole and PEA, sorry. Is atropine is not recommended in all. Atropine is recommended only in the beginning of CPR, as you have said here, the lower dose, but in cases where we suspect of vagal, that whatever caused them to arrest had any vagal stimulation, right? So those cases that I had told you guys before. Now epinephrine, and we're talking about dogs and cats, right? And epinephrine has been the only thing shown to improve ROSC. My regular ET tube supplier has them. Oh, you guys, a lot of you were asking where to buy them. So for that, I will answer more questions because we have more questions, but I want to show you something first, okay? So let me actually switch here the screen where I am showing you the screen. I'm gonna actually show you my entire screen right now because I do want to show you that is okay. So here at VetaHead, this is our VetaHead subscription, and I want to show you here because I do provide places where you can buy everything. Okay. And if we don't have it, you can also ask and we answer on our subscription. Our subscription literally has everything you need to see Zoom Med in your practice. Okay. We have quick guides here that I'm going to show you, medical calculators, we have journal clubs, we have our online courses, including a whole emergency course in zoomed exotic animals. We have topic rounds, webinars, all of that. But specifically for equipment, we have a few places here. First of all, I have a whole section of general equipment that we recommend for Zoom Ed. So this list here is everything you can possibly want and all listed here if you want to see Zoom Ed patients in your practice, okay? We have a whole list, including what we should have on our emergency cart. Also here, I have recommended books. So if you click on this, it's always updated. I have all the books separated by the categories with links that you can buy on Amazon. But last, I want to show you our recommendations area. So this is where we recommend equipment or ask for recommendations. For example, we have one subscriber, Kavita, that just asked about where to buy e-collars and materials for e-collars, and we go there and supply the answer. Also, I will always post things that are new that I'm seeing. For example, she was also asking where to purchase e-tubes, and then we give her the resources. So all of that we have here on our subscription for you, okay? So let me go back here and answer some more questions on the Q&A. Let's see. After successful CPR, when do you feel comfortable to extubate? When the patient is ventilating properly and our entitled CO2 is higher. And again, usually the entitled CO2 will be above 18 millimeters of mercury, actually between 35 and 45. But with reptiles, we might not achieve that. So usually when they are spontaneously ventilating and the entitled CO2, it's higher, I would say above 10. That's when we try to extubate them. I would also like to ask how much oxygen should be given to reptiles when ventilating. We already said that is the same calculation that you do for mammals and always 100% oxygen. Are there specific tips of guidelines you have for CPR and crocodilians? There are no specific, but crocodilians do help us in a sense that they do have a diaphragm. So kind of things are going to be a little bit more similar to dogs and cats. And crocodilians, you can actually use bigger bigger tubes, endotracheal tubes, and you can use a cuff, so you're gonna have a better entitled CO2. So crocodilians, aside for the fact that one tip I will give you is, please don't put your hand inside of the mouth, because if they return, they're gonna chop your arm off. Always use so if you see crocodilians, we have those wood blocks that have a hole in the middle that we put inside of their mouth, and we tape their mouth around the block, because if they wake up, they're not going to bite you. And that hole is to place the endotracheal tube, right? Um, what dose of atropine used for reptiles? That is a brilliant segue for me to show you one thing. Look at this, guys. In our subscription, we have emergency calculators for all the species. So if you come here and you click on reptile, it's going to take you to the emergency calculator, because you don't look at all the drugs we have here, including atropine. Okay. So, for example, the atropine dose that we're going to be used is here for you 0.02 mgs. But look at this magic. Let's say you're seeing a 300 or 400 gram bearded dragon. You come here, you put the weight in kilos, and boom, it calculates everything for you. Everything, guys. All you have to do is come here, press print results, and then print on your printer, obviously, whatever printer you have. I always have this printed for any patient that is either critical, or that I am sedating, or that I am anesthetizing. Okay, you have that in the VetaHead subscription. Let me go back here and answer more questions. I thought compression rate was based on cardiac and refilling time, not ideal heart rate. Is there any harm in doing faster compressions in reptiles? Both too. So you're looking for the recoil, right? When you're doing that. Now, it's going to be a little trickier in reptiles, right? Because they don't have a chest per se, except for the crocodilians. So here we're going to have to go based on what will be ideal for that not ideal, because that's not a thing for reptiles, because it depends on the temperature, but what would be normal, or at least closer to normal, because the recoil, it's going to be difficult for us. So the recoil is like when you compress the chest, it recoils back, right? Which is refilling time kind of measurement. I hope that answers your question, Sophia. I find that heart continues to be for a long time after administering euthanasia solution to Chileans. I can see this with ultrasound. How to proceed? This is a great question, Michelle. Leaving cage overnight and check in the morning, place in freezer before the heart completely stops. No, this is an excellent question, which is also a good segue to, I will answer that, but it's also a good segue to, for me to show you that we have our emergency course, right? So this is our emergency course. This is how our courses are. Okay. You have here this is Dr. Mariana Sadar, for example. Uh, So here we are showing you all the CPR. For example, this whole lesson that I just gave you, and goes in really depth in there for all Zubat animals. And we talk about all of that. All of them have a ebook right here that you can obviously see with the Recover guidelines. So we don't have an ebook for today's webinar, but on VetaHead, you have all the ebooks. Also, you can come here and you can have subtitles in multiple languages. Look at me speaking Spanish, like how fluent I am. And we also have transcriptions here, and we also have chapters. Say you watch this webinar and now you don't want to watch the whole lesson. You come here to the chapters, and you like, I just want to see the intubations, because here we're going to show you videos and um, pictures and videos on how to, for example, intubate them, ventilate them, and all of that good stuff. Now, about your specific question, we have a whole lesson on euthanasia, because people, we are not going to be doing that in reptiles. We're not going to be leaving them overnight in the cage. What we're going to be doing is we administer the euthanasia solution, right? The Utasol or pentobarbital, and then we're going to pit them, okay? We're going to go in their occipital area here on the head, and we're going to insert a needle, not in front of the client, because the patient's already dead, right? We gave Utasol intravenous or intravascular. So the patient is going to be dead. But sometimes, as Michelle said, we're still going to have a heartbeat. So we're going to go there and we're going to macerate basically the brain, cutting the communication between the brain and the cord and the heart. So the heartbeat's going to stop instantaneously when you do that. Okay. We don't need to keep them in the freezer. We don't need to keep the body in the freezer for cremation, etc. But we don't need to be leaving them in the cage for that long. And we show how to do that in the that ahead. Hospital response, emergency response is warm during CPR priority. No, it's not. Not even for dogs and cats. Has there ever been any success with CPR in amphibians? Oh, I actually have a sad story on my own frog. And I traveled and I left everything set up. And I used to live by the mountains here in San Diego area. In Julian, it gets really cold, it snows in there. And I left everything. I left for the weekend and I had everything for my frogs. I had Amazonian tree frogs. But there was a spike on the electricity. So the electricity actually went down. And when it came back, it had burned my heating supply for the tank. And my frogs froze. When I got home, one of my frogs that was like barely moving, I started CPR. I followed the same CPR guidelines I just showed you. I was able to bring him back, but I was not able to have him survive after bringing him back. Was the saddest thing ever. But yes, there's no much specifically on CPR for amphibians. Let me see. I will do a few more questions. You might have said this, but I missed. What do you do for compressions and chelonians? As I did say, so arms and legs going in and out at the same time is not a true compression, but the goal there is to at least improve perfusion. Michelle says, hello. So in chelonians, do we all move the limbs in and out at the proposed compression rate? Yes. Yes, all four at the same time. And again, that's not a true compression, okay? How do you secure the ECG clips on snakes? Excellent question. The same way the clips, the ECG, but another thing that we can do, and I also have that on our, before that, I want to show you this. Guys, this is revolutionary. Seriously, please be with me here. I've had subscription. We have Coco. It's named after my own African gray parrot. Coco is an AI assistant that answers questions about your cases. She does not research online. She is evidence-based only, okay, based on papers, peer-reviewed papers, and content that we have ever had that is prepared by specialists. So you can come here and ask Coco, let's say, what is a normal heart rate for an iguana? And she's going to think, and she's only going to research on the peer-reviewed papers we feed her and the vet ahead content, and she's going to give you an answer. While she's thinking right there and giving us an answer, I do want to show you guys, and I've seen, and I already placed this recommendation here, but I want to show you very quickly. So the trick for ECGing reptiles. So one thing that I like to do in snakes, honestly, the ECG clip works just fine. So in the chelonians in general. But if you're having problems, what you do, you get a hypodermic needle, and you're going to put the hypodermic needle through the skin and connect it to a male adapter at the end so you don't poke yourself. Then you put some gel on there and you put the clip, you press the clip on the needle itself. That should give you better readings, okay? So that's what I like to do. Let's see what she said here. The normal heart rate for a green iguana can vary, but it's generally around 30 to 40 beats per minute. Okay, guys, look at this, okay? She is amazing. For more precise monitoring using a Doppler flow device and an ECG to measure the heart rate. Do you see what I'm saying? It's like having me in your pocket, okay? Okay, two more questions. Let's see here. If I'm sure of true heartbeat, do you just start CPR? Yes. Yeah, just start CPR. What pressure millimeter for mercury? Okay, for respiration, we try to go between 10 and 12, not passing that. Okay, to breathe for them. right? That's what you asked to ventilate, right, Brianna? I think that's what you're asking. What is your opinion on intranasal intracardiac emergency drug administration exotics? Intranasal is not a thing. You can do inside of the endotracheal tube, okay? And then intracardiac only for snakes. The other animals, I would do intraosseous or intravenous. What is the recommended dose for epinephrine and atropine? I answered that already. Can you discuss ECG lead placement? We have already. Okay, how much does the patient temp affect the outcome of CPR? Okay, we don't have studies on reptiles specifically, but in dogs and cats, it has been shown that that's not something that's going to affect the CPR. It's not something we start right away. Okay. Exactly. Can you use the vein in the mouth of the snake? Yes, you can. But usually, if during CPR, those peripheral veins are gonna be very small. I go for the heart. Like, why try to hit something that's so tiny, right? So guys, I think Sam is just that's my cue for you too. I want to show you the last thing. I want to show you the QR code one more time, but Sam also placed here a link for you guys. I want to say last thing at VetaHead. You can go to vetahead.vet. This is our page here. And I want to say that those are our subscriptions. I'm going to place this link directly for you here on the chat. And last thing, guys, I want to say technicians and students get 50% off at VetaHead, and we have a monthly subscription, or you can pay yearly, which ends up being a little bit cheaper for you guys. I want to thank you so much for being here. I understand how precious your time is. Thank you, Sam, again. Thank you, Vetfolio, for everything. I hope you have an excellent end of your week. Thank you so much. Sam, do you have any final thoughts?
That was great, Lila. Thank you so much. Thank you, everyone, for joining us. And of course, thank you to you, Lila Parenza, for a fantastic presentation, as always. And thank you to VetaHead for sponsoring today's webinar.